After 40 years of healthcare financial management, I decided to retire for good, and my wife and I pretty much do what we want. A day like this, I'll sit on the deck watching the dogs play or watching my granddaughter play and relax. But about 2008, my wife said, Ken, your hearing is getting bad. And so I ended up having my implant in my left ear. After the surgery took place, it was like a whole new world opened for me. I could actually hear better. I could hear the TV. I could hear people talking. It really improved the quality of my life. There's no question about that. It was one of the best decisions I made. Sandy was my audiologist I went to, and she was a very caring person.
I see patients as long as they need me, and for my cochlear implant patients, that is the rest of their life. Having that trust, knowing that I'm in their corner, is really important, especially when you have this device and you need this device to hear. Prior to remote care, there was very limited hours that we could see patients. We'd have to schedule an hour for any change we wanted to make because you don't know what you might be running into. Now we can have those appointment times be shorter and more efficient for the clinic, but definitely more efficient for the patient. And we can do a 15-minute remote assist appointment in between whatever they have going on that day.
It was easier than I thought it would be. I'm doing that from the comfort of my home in the environment that I'm going to be listening to the majority of the time. I didn't have to drive 2 hours into her office, and we could do it and make sure everything was okay. When you're working with any kind of healthcare professional, as a patient, you have to have the confidence in that individual that the person is looking after your best interests.
Cochlear has always been at the forefront of technology. They've continued to make things better for our patients, continued to make things smaller, more accessible. It hasn't brought me away from my patients, it's brought me closer to my patients.